at the level of we are. So a mobile crisis team is dispatched whenever you need more intensive services than what 988 can provide. 988 is the call center, and then they dispatch the mobile crisis team. A mobile crisis team is a pair of individuals, licensed mental health professional, and then what we call a peer recovery support specialist. What a peer recovery support specialist is somebody who has lived experience with mental health and addiction. They have walked that journey, and there is a lot of evidence and a lot of outcomes associated with positive engagement. If you have somebody who's interacting with you that says, I have been where you have been, and I can help you get to the other side because I am a physical proof that it can happen. So we have those two people as part of our mobile crisis dispatch team, and we have that statewide coverage. As of today, we've had over 500 mobile crisis teams dispatched to de-escalate the situation, provide the service, whatever it is that's needed, and then again, connect them to care and treatment for ongoing services so that they don't necessarily experience a crisis again. So they know exactly what to do and where to go and who to interact with in the event that they need more. But if that's not enough, we have another layer. And that another layer is, I know we've really tried to think about the whole thing. In November of last year, in anticipation of this entire system that we have built, we changed a law. And that law was that law enforcement is not required to take people to the hospital anymore when it's over 30 miles to the next, when it's over 30 miles to the nearest mental health facility. In every other state, we're the third state to do this. It is still a requirement that law enforcement has to put you in handcuffs, put you in the back of a car, and take you to the psychiatric hospital. That is, again, I don't know any other illness that does that. But that is a deterrent for people to reach out in the first place. They don't want to be involved with law enforcement, especially if they're using drugs or they're, experiencing hallucinations. That's just another layer of scary that they're not willing to seek treatment. And then again, we kind of go down this pathway toward homelessness, criminal incarceration if they don't get their mental health needs addressed. So this mobile crisis team can now turn into what we call a transportation service vendor. We're also we're a rideshare company, just like an Uber or a Lyft now. And we have provided over 8,000 transport services since November of last year. And all of those services have been provided in a way that's trauma informed and safe and secure, where law enforcement's not needed. And so we're able to, again, help law enforcement stay in law enforcement's jurisdiction, if you will, so that they can do the job and not be taken into the mental health space when it's not necessarily needed. And so these mobile crisis teams can transport people to the psychiatric hospitals or what we call an urgent care or a crisis center. So that is the next layer, which is an urgent recovery center. You can think about as like an emergency room for mental health. Brick and mortar facility. I think you actually have one here in Stillwater, one of our newer ones within the last year. And what that is somebody can walk in 24 hours a day, 7 days a week, or can be brought in by a mobile crisis team or however. And what you get is immediate access to medication, a psychiatrist, a counselor, a case manager. If your crisis is a crisis of need, employment services, housing services, whatever it is that's causing you emotional distress, that we want to keep you engaged and stabilized in your community, being a productive citizen to your community. These urgent cares are where you can go. We have lifted 9 additional urgent cares across the state, and we will finish opening the 23rd newest crisis center at the end of the month. At the end of this year. And we will continue to build these urgent cares and crisis centers so that people have a place to go if they need more services than what the 988 call center can provide, the mobile crisis team can provide. We have actual facilities that people can go to receive treatment and help. And so far, it's been going very well. And what we hope to achieve is just to meeting people where they're at whenever they need it, exactly what level of care that they actually need. And no other state's really doing this kind of comprehensive approach to it. And what we know is that every year in Oklahoma, 880 people die by suicide. One person dying by suicide is way too much, especially when we know it's a preventable disease. It's a preventable illness. What's even scarier is that in our schools, we have data that we collect through all the public schools and our partnerships with different private schools and charter schools, and that 1 in 10 kids at this point today are reporting attempting suicide. 1 in 10 kids. That's a very alarming statistic, and that's specific to Oklahoma. Kids are arriving in emergency departments because they don't know what to do. Parents don't know what to do for their kids. 31% more than they ever have in our history. And so it's a perfect time to have built this system, this most comprehensive system that starts with the 988 number, especially in the functionality of being able to text and chat, because that is also what we know our younger generation is more comfortable in doing. And we're excited about having all this. And so we hope and we know that within the next year, after the system has been, had some time to actually make an impact, we will see a significant change in the emotional stress and the suicide, the substance use prevalence across the state. So we're really excited about all of it. It's just, I have to pinch myself all the time and say, is this really happening? Am I awake, or is this a dream? Because I've been in the field for 12 years this month, specifically working for this organization, trying to get to where we're at today has been pretty remarkable. And I know, and most people at this point have know what it's like to have a mental health challenge. Everybody has mental health, right? It's like physical health. It's something that you have to attend to. It's something that you have to nurture and care for, or you become ill. You become physically ill, you can become mentally ill. Everybody has a disposition to be ill. It is how we handle our stress and how we manage that stress. Otherwise, it becomes a mental disorder or mental illness, or sometimes that becomes a substance use addiction. And so it's very important, especially after the combined stress that we've experienced as a nation, as a globe, with COVID and the isolation piece and the uncertainty of what is this, that we all have a better way to talk about mental health, because that, at the end of the day, is the most powerful thing that you can do as a community leader. And so thank you so much for allowing me to come tell you about this great stuff so that you can go and tell other people about this great stuff. And if you have an experience of yourself or somebody that you're close to, a family member, a friend, a neighbor, about mental health and the success that they could achieve with recovery or calling or using the 988 system, will help continue to grow the message so that 988 becomes just as synonymous with 911. It's such a prevalent thing that people know that when they're experiencing emotional distress, they dial or text 988. And so there we go. That's my presentation. Usually there are a lot of questions, so I try to reserve some time for that. Yes.
LGBTQ system or situation that we have in this country. I'm talking this percentage of calls you get.
For the 988 system?
What percentage of those are related to the LGBTQ situation that we have in this country?
We don't necessarily collect the demographic related to a sexual orientation or sexual identity when people call in to the 988 system, but I can tell you from just like general statistics from a national perspective, there's usually a higher prevalence rate of people who experience suicide or addiction in that community. Yes.
Yeah, I'm interested. We're glad you're here, by the way, to tell us about the program. Other than like suicide prevention, what kind of situations would you send a team out to, and are they ever in danger, maybe getting into a difficult situation?
That's a very good question. And so it kind of depends on how the person's interpreting their crisis. We try to safety plan with people, which is if you have like a plan and an ability to go through with an act of suicide, or your use of substances are such that you are in dire need of some physical intervention, then we will dispatch those crisis teams. Now, if there is, for example, out of those dispatch teams, so far, there has been 1% of those teams where we have had to do a co-response with law enforcement because there was a threat of safety to the individual and potentially put the person who is responding in harm's way as well. And so in those instances, we coordinate with 911 to make sure, and local law enforcement to make sure that there's a co-response with those situations. Yeah. Yes.
2 questions, if I may. I must confess I've not heard of the 988 system before today. So the first question is, how are you promoting it statewide? And the second question is, you mentioned a 30-some% increase in school-age children suicide attempts.
Yeah.
What is the cause of that, if it is known?
Yeah, there's a lot of speculation on what the cause is specifically. I don't think that anybody can really firmly say what it is. They just know that youth are presenting more frequently at emergency departments because they are experiencing so much stress and so much anguish, so much isolation. And sometimes people are pointing towards the last couple of years where the developmental stage of youth was disrupted, where they were not able to socialize with their peers and be able to go to school and things like that on a consistent basis. Their world was changed. And so we're seeing, and that's the prediction, is that we'll see a lot more mental health cases in the coming years because of the aftermath of the pandemic and the way that we closed things down and things like that is the assumption. And I don't know if anybody can really say 100% that that's the cause, but that is definitely correlated to an extent where it's something that we're approaching that way. In terms of the promotion, we hit it heavy next month, and there was a strategy behind that. We slow launched it a little bit in September. We just wanted to make sure it worked before we started promoting it. Is really what it was. And so over the last year, I've been going to Rotaries and speaking to folks to just kind of get people amped up and ready for it so that they knew about it. I hadn't been to Stillwater yet. This is our first time. And so you will see bus benches, you'll see coffee sleeves, you'll see commercials, you'll see billboards, you'll see on the nozzles for the gas, it'll say it. I mean, we know, and what's so good about having this really cool system if nobody knows about it. And so we took a strategic effort to make sure that we are going to hit everybody, and the message is very tailored to different populations so that we speak to, youth or older adults or women or veterans. So we're targeting people specifically, and of course social media and digital website things. So we've got it all, and that's my job and my primary job. Yeah.
I've seen a lot of it on social media. Okay. I mean, yeah, in addition to probably those other places. I just have a quick follow-up to the youth question, actually. You mentioned that youth are having a higher prevalence of attempted suicides. So if a youth or minor contacts the number, is how their case handled any different than if an adult utilizes the system?
That's a good question. And so to the extent anybody can call into 988 and be anonymous. That is an important factor that I didn't mention. So thank you for making me think about that. So anybody can call into 988, and that's another kind of level of protection for the person so that they don't have to identify themselves. Of course, if there is a situation that is indicating that we need to dispatch somebody, we can access geolocated things and be able to send out, and like 911 does. But kids and youth are able to interact with the system without having parents involved. And so that's another way of kind of getting them to maybe be more open with whatever it is that they're struggling with. But when we talk about giving them appointments and scheduling them, there will have to be a parental kind of approval and signature that happens whenever that kiddo goes to a treatment facility, or if mobile crisis is dispatched, there's, they will try to achieve some type of parental consent. Yes. Yeah.
Okay, thank you. Thank you so much for being here. I'm really excited to hear about the program. My background's in human resources. And so typically a company will have an employee assistance program where employees can access mental health counseling, but you typically get 3 to 5 free sessions. And after that, it costs. It's not necessarily covered under insurance.
Right.
And now working at the university, I see how much students, when they're transitioning from graduating from college, going into the working world, there's a lot going on in that time of life. They're really struggling, but they're not able to get that ongoing counseling that they need because it costs money and they're poor at that stage.
Right.
Do you see any shift in that where mental health ongoing counseling just becomes like any other type of healthcare that I don't have to pay a ton of money out of pocket for?
Yeah, that is it's a really good question, and especially in terms of the national conversation that's happening right now on parity. So oftentimes insurances, and with more people who are vocal about it, the more that the insurance companies will make sure that those mental health and addiction issues are treated just like a doctor's visit. It doesn't have to be specially approved and have a, some type of limitation on it. And that it's affordable, like a regular copay versus, a specialized copay. And so, yes, I think that we're on the verge of that happening at a national level, which will impact all the states. I know that locally, we have advocacy groups that are working for that parity piece, and you'll see probably legislation come this next session about that specifically. But what's nice about 988 is that it does fill a gap for that, so that they're able to, that anybody is able to kind of get that immediate kind of therapeutic response, and then identify what local treatment provider that you could connect with that has a sliding scale or no cost. There are in the state, we have 13 what they're called comprehensive community behavioral health clinics, and they are the backbone of our treatment system. And they're contractually required to serve anybody that walks through their door, regardless of ability to pay. And so that's another really good thing to know as a community. You have a CCBHC for an acronym. I know everybody hates acronyms, but I don't want to say all those words again. It's called GRAND. They just changed their name, Grand Mental Health. They're the entity that operates the urgent care here locally. And they think they've been here for maybe a year and a half now. And they are one of our most innovative CCBHCs, where they use technology. They disseminate iPads to all of their clients so that the person can have immediate access directly to their therapist or their case manager or their peer or their doctor or whatever it is. And because they see that in and of itself as a return on investment of their services. So you have a really fantastic CCBHC here. So I would definitely lean into them.
One quick follow. Is that the former Grand Lakes referring to?
Yes.
Okay.
Yeah. The Grand Lake Mental Health, they just went through a rebrand called Grand. They're trying to shorten their name. Yeah.
No, just one quick comment related to the, you were talking about the kids in schools and all that, and what they're going through isolation, all that. I think social media also plays a big role in that
100%.
too.
Yep.
And I just really wanted to say comment wise that it is refreshing to hear that through your initiative and what you're doing, bringing mental health to the forefront and treatment of, and how you're going about it is one of the top, if not the best in the country. And that's refreshing from Oklahoma standpoint to be in that position versus the other position.
Yeah.
So we appreciate what you're doing.
Thank you. It's like I said, it's been a long time coming. We have just the right mix of things happening, where we have legislative support, governor support, right people in the right seats at the organization leading the change. It's a perfect storm.
One of the lead articles today in the Tulsa World on the front page was an interview and an article from the district attorney, Stephen Kunzweiler, in Tulsa, who was stabbed by his apparently mentally ill daughter. And so he was pleading for more state support for mental health. Great opportunity to piggyback on that.
Yes.
He didn't mention this program, by the way, in his interview.
Right. And we definitely have reached out to his office to say, hey, we've got, it just so happened that today there was a huge investment and that we've been building this stuff. And of course, we won't see the impact for another few months. We're feeling it right now, but we won't really be able to look at the data and say, hey, look at what we are able to actually impact with this system and the access to it. But yes, it's a unfortunate story that I hear often, way too often. It wasn't but 5 years ago that there was another high profile person, the Costello was his name, and he was stabbed by his son at the Brahms. And so, yes, we've been needing to do something for a very long time. And finally we have, the investment to get something done.
Yeah, the question, thanks for being here today, by the way. In regards to, let's say an individual calls and they're talking to this counselor and there's suspect of this individual being a victim to like abuse, whether it's sexual or just whatever, domestic abuse, and it's to a point where this counselor thinks, well, should we intervene even if the victim doesn't want them to because it's required? Is that
so? That's
something that
a
happens
typical experience in any type of community mental health type of situation. So there's ethical guidelines and reporting requirements that are, regardless of if they're over the phone or if they're in their office, that they have to abide by. And abuse of a child and neglect of a child is one of those things. So there would be a coordinated kind of response to engage with the appropriate DHS if it's DHS, and a co-response there, but also making sure that if there is a need in the state of Oklahoma, the counselor, the licensed person, has the ability to put somebody in an emergency order of detention, where they are then required to go into protective custody and then be transported to a hospital if they're unwilling to go. Let's say if it's that situation. So try to speak to both of them.
So even if they're trying to be anonymous, there's a certain degree in which you can step in because
yes,
and finding people on their phones.
yeah. But that, in terms of like the protocols and the procedures for like the call center, it has to meet a certain threshold before they can, kind of take a deeper dive into your information. And the confidentiality laws and the substance abuse 42 CFR laws are very clear on when those situations can arise. And so they're retrained on it every year. Yeah.
So we have extension educators in all 77 counties in the state that interact with farmers and ranchers and others in rural communities. So is there a website that has this updated information on 988 as well as the location of the 13 facilities?
Absolutely.
Okay.
So it's called 988oklahoma.com.
Great. Thinking if I Googled 988
you
Oklahoma,
can,
I would
pop
find it.
up.
So
That is my goal.
Thank
is
you.
that you can, hopefully when you leave here and you pull up your phone, it'll already know. There's also creepy technology that does that too. It's always listening. If you didn't know, your phone's always listening to you. But on that website, not only does it have the locations and the ability to access what I've been talking about today, but it also has the ability for you to be an advocate of it. So whether it's a toolkit on how you can be, host an event or talk about this with your, other community leaders, or download and print posters. I have posters here today. Please take some if you'd like to hang them up in your businesses or whatnot, so that you can have the information and spread the word from that website.
So I've got a question and a comment.
Yeah.
The question is, OU, I believe, is building a new pediatric psychiatric hospital.
That's what I hear.
Okay.
Yeah.
Do you know the status of that at all?
I have, I think it passed the Senate today. I'm not sure. There were certain regulations that they included in the language of the bill that would finish out the ARPA request for it, but I think it has to pass the House and the Senate today.
Well, the reason I asked, my wife's a pediatrician, and for her to get access to mental health care for her pediatric patients is very difficult.
Yeah.
A lot of providers will not take sooner care. They're backed up. First assessment will be 9 months from now.
Yeah.
So that's really a major concern for her. I hear that all the time.
Yep.
So the suggestion, when you call your doctor's office, first thing you hear is, if this is an emergency, dial 911. How about adding on to that? If it's a mental emergency, dial 988.
That's a really good point. I did not think about that. Yeah.
That will only cost you $1.
That's great. Thank you so much.
I have one more quick question. This will be an easy one to answer.
Yay.
Do you have the resources currently to serve non-English speaking community members in our state?
So specifically Spanish speaking individuals. So all of our materials, by the way, are in Spanish as well. And, we'll have marketing material and commercials translated in that too. But whenever it's another language, because there's multiple kind of populations in Oklahoma that don't speak Spanish, don't speak English, we use a service often that's called Language Line, which helps to facilitate and communicate those barriers between, so that a counselor can become a middleman translator by using this language line. Yeah.
So does that language line work for all languages?
Most languages.
Okay.
Yeah.
So it's not just Spanish.
Yeah. It's when the Spanish, usually most of our agencies have a Spanish speaking person or multiple Spanish speaking people, but it's usually most often used whenever it's a language other than Spanish or English. Yes.
One question I had was do you get quite a few calls from people, especially like elderly people who are lonely and just feel depressed for lack of social contact?
Yes.
I know a lot of people who live, elderly especially, who live by themselves or who are caregivers for an invalid spouse, seem to lack social contact, and that's
yes.
problem.
So we're seeing actually an increase in that too. So on both ends of the lifespan, a huge uptake in the younger folks who are experiencing emotional distress and not knowing what to do with it. But then on the other end, with older adults experiencing a lot more and more frequently. And so yes, 988 can provide those services and be a warm line, if you will, for people who just need to have somebody to talk to, or maybe even a connection to a local group of people who are also experiencing the same similar issues that they can help facilitate connecting to. I will say that it's just in our dashboard that's associated with our website. You can, even as a public, because we believe in transparency, you can see the categories of issues that people call for, so that so most of them are suicidal issues, but there are oftentimes people just need to understand how to get connected to a resource, or they're experiencing, they want to know more information to help their neighbor or their friend. And so there's a category for that. So there's multiple categories so that you can even see why people are calling in the state. So I forgot to say that. So I just made your question relate to that. Sorry. Yeah.